training, you don't have to study medicine, general medicine, and then specialize into podiatry. You can study straight into podiatry as if it was physical therapy or something like that. So I can't do as much as Dr. Robinson can do. I can't do surgery. But yeah, so Dr. Robinson, how long have you been practicing, Dr. Robinson? And tell us about where you studied and so forth.
Yes, thanks for having me. I have been practicing now for almost 5 years. This June will make 5 years. I attended Temple University in Philadelphia, and that's where I went to medical school. And then I did my surgical residency in New York at Wyckoff Heights Medical Center. So.
Excellent, excellent. And so why did you choose podiatry? I mean, out of all the parts that you could specialize, why podiatry?
So I actually got into podiatry in college. That was my first exposure to podiatry. I was shadowing different physicians while I was in college, just trying to figure out what specialty I wanted to choose. And I liked podiatry because of the diversity of it all. You can basically do everything in the lower extremity. Every day is different, and you also get to treat patients, especially patients that look like me. There's not a lot of podiatrists that look like me. And so it's kind of great when I have patients and they're excited to see someone that looks like them. So that was also a big draw for me.
Excellent, excellent. And what are the highlights? What are some of the highlights of your 5 years of practicing now?
I guess the biggest highlight would be starting my own practice. So in March of this year, I opened my own practice, Meridian Podiatry, here in Jacksonville, Florida. So that has been the highlight of my career so far. Yes.
So far, praise God, praise God. So we have a presentation for you. We're going to be talking about various aspects of foot health. Sister Raina, did you want to say anything else before we launch into this presentation, or did you want me just to go straight ahead? I suppose silent means consent, so we're just going to jump straight on into it. So I'm going to share my screen with everybody. Okay. Can you all see the screen?
Yes, we can.
Yes, we see it.
Praise God, praise God. So we're just going to be talking about various aspects of foot health. You know, for a lot of people, foot health is probably the last thing on their mind. They worry about their face, worry about their hair, especially if you're a Black female, you're worrying about your hair, you're worrying about your skin, and you know your waistline, and whether your butt look big in this pair of pants or not. But when it comes to your feet, as long as your shoes look good, you feel okay. For a lot of people, their shoes cover up a multitude of issues, and so we're going to be looking at feet, and because feet are vitally important, especially when we come to the end time and the work that God has for us to do. We're going to be using our feet a lot, and so we need healthy feet, know what good footwear is, so that we can maintain good health and walk around comfortably for hours and hours and hours without straining your feet and doing them damage, or doing the rest of your body damage, because damaging your feet can lead to damage elsewhere as well. And if you have any questions, feel free to drop it in the chat, and we'll try to get all your questions answered. So podiatry is a branch of medicine that is just devoted to looking after the feet, looking after the foot health, all aspects, you know, ankle and below. Even though we may study other aspects of the body, the focus is the feet. Did you want to add anything to that, Dr. Robinson?
So for us here in the US, the scope of podiatry is different per state. So for the state of Florida, podiatry is below the pelvis. So from the hip down is our area of specialty here in Florida.
Wow. Okay, so first aspect, we're going to talk about footwear. and what good footwear is and what it's not. Okay, before we look into that, we have to understand when you're choosing a pair of shoes, you have to think, what is the purpose of the shoe? Is it just to look good in church? Or are you going to be playing sports? Or are you going to be doing a particular activity, like working in them or walking in them? You need to know what the purpose of the footwear is. You also need to know how long you're going to be wearing this particular footwear. So for example, you say, okay, I'm going to go to church, so I'm going to wear a pair of 6-inch heels. We don't recommend it, but you decide to wear a pair of 6-inch heels, okay? And you look good, okay? You look good, but you plan just to wear it. The moment you get out of the car, you slip them on, okay? And you hobble around all during church in them, looking good, but hobbling around, okay? And then when you get back into your church, into your car, you slip back on your flats, okay? So you have to know the duration of how long you're wearing your footwear for. The third thing is you have to know your size. Now, when let me say this, let me put it nicely. They did an experiment some years ago in England, and one of the major shoe companies in England is a company called Clarks, and they manufacture healthy shoes. And they had this mobile unit, and they would take it into a city center where everybody's shopping, and they would ask people to come in and choose a pair of shoes that fit them. And they had women's shoes on one side, men's shoes on the other, and they were all the same color, all the same style. The only difference was the length and the width, and people could try on any shoe they wanted in their gender and choose the shoe that they thought best fit them. And then after they chose the shoe, they would then have their feet professionally measured. And what they found out is this, that women in general, and this is a generalization, women in general chose shoes which were a size too small. One whole size too small. Whereas men generally chose the right size shoe. Remember, the size is not just the length, it's also the width of your shoe as well. Okay, because your foot can not just move forward and backwards in your shoe, it can always also move from side to side, which is also a problem. So you need to have the shoe that provides enough room in the toe of the box so that your toes can actually function during the gait cycle. You don't want it so tight so your toes can't function, or that there's so much room that you're slipping down, or it's too much width so that you've got side to side movement. So the shoe has to be snug on you without being tight on you. And the final consideration is your environment. Are you walking over icy ground, rocky ground? Are you walking on a hard concrete surface? Are you walking on a rubberized running track or on grass? You need to know the environment. Is it going to be a wet environment? Is it going to be mostly a very hot environment? You need to know that environment. So when you choose those shoes, you have to think about all these factors, okay? All these factors when choosing the shoe. So you need a shoe that is not too wide across the toe, the width of the shoe, and your toes can function and move. You should be able to wriggle your toes at the end of your shoes. You should be able to do that. Now, I just want you to do that. Some of you got some footwear on right now. Just wiggle your toes at the end of your shoe. If you can't wiggle your toes, then there's a problem, okay? Because you won't be able to walk correctly. And the back of your shoe, where your heel is, your heel should stay snugly in the heel cup of your shoe. Okay, most of the time you have laces or some sort of fastening to keep your foot from slipping forward. Now, the problem is when you have a slip-on shoe, there's nothing to hold your foot slipping forward in your shoe. And if it slips forward, the gap that was meant to be at the front of your shoe goes to the back of your shoe, and you start walking out of your shoe. So slip-on shoes, by design, has to be tight on your foot. They have to restrict function. So you have to have shoes with laces or some sort of fastening if they're going to be a long-term comfortable shoe. Okay, other things you need to know about shoes: you should wear flat shoes, especially young ladies before they finish growing, because high heels causes the pelvis to tilt forward and to contract around the birth canal. So wearing high heels makes it more difficult to give birth naturally, because your pelvis is tilted forward and has contracted around the birth canal. So avoid wearing high heels, especially in young women who have not stopped growing as yet. They're still growing. Okay. But if you want to wear high heels for an hour because you just want to look good, knock yourself out. You just keep the podiatrist in money. Okay. Yeah. So I think that's about your normal shoe. Also, the material of your shoe. I know Raina's very concerned about plastic shoes. Dr. Norsha, did you want to say something?
No, I was just saying job security. So yes, those high heels keep me very busy.
Come on now.
We are so elated that you chose to join us today on Healthline-USG. Many of you have called, written, or sent numerous emails of your appreciation of these weekly programs. We encourage your financial support to this ministry. The Healthline-USG is a crowd-funded organization dedicated to serving the community, families, in the areas of health, wellness, and agriculture. Your financial support will be used to fund educational content such as this one. The information for providing that financial assistance will be located on the screen and in the description box below. Thank you so much for joining us again, and please enjoy the rest of this video.
Keep on coming back for more.
Right.
The material of your shoe. Now, modern materials are very good. Before, plastic years ago was very terrible. It didn't allow your skin to breathe. There was high humidity in there and so forth. So that was terrible. Okay, but nowadays you have great Gore-Tex fabrics and other fabrics which allow your feet and your skin to breathe and air to circulate. So shoes are far better designed. The insoles nice and cushiony, especially if you're walking long term. The laces high up enough on the bridge of your foot, and the heel cup deep enough to cup your heel. So that's in your normal shoe. Different types of shoe, whether it's Oxford design or a Derby design of laces, it doesn't really matter. Derby is slightly better because you can get a whiter design. That's just the way it's laced up. Okay, now when it comes to a walking shoe, a walking shoe needs to have all those fitting functions as well. And the walking shoe needs to be of top quality material, because it's going to go through a lot when you're walking, and they need to be high enough and give you enough ankle support so that you can minimize ankle injury. Now, when you do have walking boots, don't just lace them up halfway. You need to lace them up all the way to the top. Otherwise, you nullify the ankle support. You need to do them all the way up and tighten it up around the ankle. But same thing before, enough space in the toe box, nice and snug around the heel, not too wide. So, and when you buying a good pair of hiking boots, expect to pay going on $100 for a good pair of hiking boots, okay? But it's worth the money. It's worth the money, because when you think about them, you could be in them all day and you're walking for miles. You want to be comfortable. You shouldn't go walking and at the end of the walk, you've got blisters or other damage from your shoe. You shouldn't have pain as a result of walking in your shoes. Now, your high heels, that's a different matter. Okay, but from your walking shoes, they should be perfectly comfortable. Okay. Sister Mills asking a question: is rubber sole, is this a good shoe, a slip-on?
Oh, I believe she means UFAs. So UFAs are a rubber, they make rubber sandals. I think they make clogs as well, but they have a really good arch support. So if you're gonna wear a slip-on shoe, I guess that's a better option than wearing one that does not have an arch support in it to help to prevent strain and fatigue of the arch. So if you're looking for a sandal, yes, UFAs, you can wear UFA.
Okay. But in the long term, you want to have shoes without arch support because you're just weakening the muscles. The bones in your foot are so designed that they can support themselves and the ligaments will hold them together. If you continue to have an arch support, those ligaments will weaken and you'll eventually have a flat foot. So you do want to strengthen your feet. So walking around barefoot is good. It actually exercises all the muscles in your foot. Okay. But having an arch support long term isn't good. It's just like wearing a neck brace long term. The muscles in your neck will weaken. Okay. Any other questions about shoes?
But I thought orthotics, because that's what they gave me years ago. I thought orthotics were for long term, for your arch support if you're flat footed.
You have to create, orthotics help to create and get help train your foot muscles to work in a particular way. But to have them long term, and it really depends on the orthotics. Because when we created orthotic, you could have a heel raise as an orthotic. Okay, orthotics aren't just arch supports, so it depends on the type of orthotics. Sister Norshe.
Yeah. So for a custom orthotic is an impression that's taken of the foot, and it would be a device that you would wear in your shoe. With our current society and the lives that we live, there has been significant changes to our daily activities. And so for some people, not having that support in the arch is actually more detrimental than having it. There wouldn't be any way based on the life that they lead and the activities that they participate in to further strengthen the arch, and going without the arch support or the orthotic would cause even more pain, especially if you've already had weakening of the arch and the muscles that support that area. And this you see a lot early on in kids when they start doing activities very rigorously, because now we've changed where instead of participating multiple activities, kids kind of specialize very early. So we see a lot of issues with that. We see it a lot with women during childbirth when they're pregnant, because of the hormones that are secreted, causes relaxation of the ligaments around the foot and the ankle. So you do get a lot of heel pain, swelling around the foot. And so those are usually the biggest times where wearing an arch support would be beneficial. Now people also work more on hard concrete floors, which put a lot of force back up into the foot. And so wearing a well-cushioned shoe and an arch support can be beneficial in that area if that's the environment that you work in.
A couple other questions, Dr. Norshe. What if you have a high arch?
So there's quite a lot of people that believe they have a high arch. It's not necessarily the case, but if you do have a high arch, most of the over-the-counter inserts that provide arch support or that shoes that provide arch support won't work for you because it's just not high enough. That's not the most common way the arch is for the majority of the population. So a custom orthotic is definitely recommended for somebody that has a high arch, especially for women. Like I say, when they, after giving birth, a lot of women with high arches have a lot of problems because of the collapse of that arch that happens because of the hormones that are released during pregnancy. And this is also the time where the foot gets bigger as well for women, which is why they don't take into account that it's happened. During pregnancy, the arch collapses, the foot gets bigger, shoe size changes, and we don't take into account we're happy to go back to the shoe that we were wearing prior to pregnancy. So that's a lot of why most women don't wear the right size shoe, because who wants to buy a whole new closet full of shoes?
Yeah. Yeah. So yeah, when you walk, you should see an imprint of on the sand. You should see your heel, you should see the ball of your foot, and you should see an imprint attaching your heel to the ball of your foot, and you should see the imprint of your toes. Now, if you do not see that connection between the ball of your foot and your heel, then it's possible you have a high arch.
Right.
The problem with having a high arch is that you have less surface area bearing the weight of your body, which causes extra stress on your heel, extra stress on the ball of your foot, and it could lead to more calluses and corns and so forth. Next question, how do orthotics help with the heel spur?
So a lot of people associate a heel spur with having heel pain, but you can have plantar fasciitis, which is heel pain. You can have it with or without a heel spur. An orthotic can be specially made to provide cushioning around where the heel spur would be to decrease the pressures that go back into the foot and cause pain and inflammation around the heel spur. So that's how an orthotic would be beneficial if you do have a heel spur, is to offload that area, decrease the pressures in that area, which would then decrease the pain and inflammation that you would experience.
Sure, yeah. It shortens the plantar fascia by raising the heel a little bit. It shortens the fascia and it stops pulling, the plantar fascia pulling on the heel. It's a tough membrane that attaches the heel to the ball of your foot and helps keep the arch intact. But when that's overstressed, the end of it calcifies and turns, and that's how you get the heel spur. But by raising the heel a little bit, it shortens it and causes less strain on it. Here's another one. When I walk around barefoot, I get plantar fasciitis. And when I put on shoes with a decent arch support, it feels better very quickly. Is that a question or are you just testifying, Miss iPhone? Thank you for testifying. Does arch support contribute to lower back pain? Sorry, does a high arch contribute to lower back pain?
So the biggest contributing factor to lower back pain outside of arthritis and stenosis is tight hamstrings, and that's part of our society. Most of us have jobs where we sit for long periods of time, which causes contraction of the hamstrings and the calf muscles. And that's mostly what contributes to lower back pain, is that tightness and pulling, which then alters the positioning of the pelvis.
Okay, and how are they going to cure that?
Stretching.
Yeah.
Stretching is the biggest thing, regaining that motion and mobility in the hamstrings and the calf muscles to then decrease the pull and tilt on the pelvis. Part of the compensation for tight hamstrings is a collapse of the arch, but it depends on the structure of your high arch if it's able to even collapse at all. And if there's no way for it to collapse to provide that compensation for the tight hamstring, then yes, you're going to have significant lower back pain.
Sure. And you need to exercise. Yeah,
yes, stretching. That's a big thing that needs to be incorporated in addition to doing your exercises is stretching, because a lot of us are tight.
Yeah. So doing your warm up, doing your stretching, and doing some exercise. You know, if we walked after each meal, we'll be great. We'll be great. Okay, let's move on. I haven't ignored this question about the calluses because I know we're going to come to calluses later on. Let's talk about shoe care quickly. If you invest a lot of money in your shoes, you got to look after them, okay? Keep them nicely. If they're meant to be waterproof, make sure that any cuffs are rubbed out and scratches covered up with a good waterproof polish on them. Okay, you know, we live in a society where we don't really look after shoes. We wear them, and when the season is done, we throw them away and buy a new one. You know, this throwaway lifestyle isn't an end time mentality. We have to start looking after our shoes, and good quality shoes are better to look after than cheap ones. You know, cheap ones are designed to be thrown away. Whereas
That's what I was gonna say. Yeah, the biggest thing is buying quality shoes that will last. Because if you don't, there really isn't anything to take care of. It's gonna fall apart regardless.
Exactly. Okay, let's move on to skincare, Miss Norshay.
All right, so skincare. The skin is the biggest surface of our body. It protects us from environmental stresses, and it's important for us to take care of it. The biggest thing that we can do for our skin is to moisturize it. There's environmental stresses, the sun, which dehydrates our skin. There's different diseases that causes dehydration of the skin. So putting that moisture back into the skin is very, very important. Drinking a lot of water to hydrate the skin is also very important, but definitely you want to be sure to protect your skin, checking to make sure there are no cuts or wounds or scrapes, any breaks in the skin, because those cuts and breaks provide points of entry for bacteria or fungus to get into the skin and can cause other infections, which we definitely would like to avoid. So the biggest thing is moisturizing your skin and drinking water.
And I think that Black people like to moisturize their skin, but you have to remember your skin extends all the way to your toes. Okay.
Yes.
Stop at your ankle, then stop at your knees. It goes all the way to your toes. It's cream all the way down, and also your foot bottom as well.
Yes, and Vaseline is not a moisturizer. That's a big thing that I encounter. People say, well, I put Vaseline on. It's like, it's not a moisturizer.
Yeah. And just to explain that, because Vaseline is just oil that helps to keep moisture in the skin, but it doesn't add any moisture to the skin.
Correct. So if you want to use the Vaseline, I recommend putting a moisturizer on first, and then you can seal that moisturizer in with the Vaseline, and that'll help to lengthen the amount of time that your moisturizer will stay on the skin.
And you cream everywhere except in between your toes.
Correct, yes.
Okay. Because there's enough moisture in between your toes as is. Calluses.
All right.
Tell us how they develop, how to treat them.
So calluses are a result of friction. They're your body's way of trying to protect itself from the increased forces that it's experiencing. So if you're getting calluses on the heels or in the ball of the foot, the toes, what that means is that area of your foot is experiencing extra pressure, extra friction, and it's trying to protect itself by building up this thicker, more resistant skin, if you'd call it, to try to protect itself. Now, if the pressures and the friction isn't removed, the callus continues to develop. It is a very hardened skin, which does not have any shock absorption. So that can then lead to pain, because the way the foot is designed, it's supposed to absorb shock and distribute that shock throughout the foot to prevent pain. Now, when the skin becomes calloused, that no longer happens. So managing the calluses, wearing the appropriate size shoe, wearing the appropriate style of shoe is very important to help to distribute the pressures evenly across the foot and decrease the callus formation that you're getting. So if you're seeing calluses, it means that you need to change something.
Yep, so definitely. And also, between your bones and the skin, there's something called a fibro fatty pad, that's really dense, fatty. When you feel your heel or baby's foot, is this fat on it, okay? That helps to cushion. As you get older, that can wear out. So that may add to it as well, a reduction in the fibro fatty pad. So how do we treat it?
So wearing the appropriate shoe, offloading the areas that are getting excessive pressure. So an orthotic would be able to do that. If it is a fat atrophy issue, we can actually do fat replacement injections or fat augmentation procedures. If you're, especially for the ball of the foot, is a very common area where the fat atrophy occurs, meaning that the amount of fat that's there to cushion the bones decreases over time. And so we can actually put that fat back to help to alleviate the pain in that area if everything else isn't working. So you've tried an orthotic, you've tried a shoe, and it's not working.
So where do you get the fat from?
It is harvested. So it's donated. Some of it, there's different kinds. There's harvested fat. There's some that's engineered. You can also use hyaluronic acid fillers to replace the cushioning in that area. So there's different substances, if you want to call it. Pardon?
They couldn't take it off their hips and replace.
No, because the fat that's around your hips is actually a different composition than the fat that's on the heel. So if we were to put the fat on your hips on the heel, it would really do anything. It would wear away almost immediately because that fat isn't used to bearing the pressures that you're bearing on the bottom of the foot. So unfortunately, it would be nice, I mean, you know, to take that fat and put it where you need it. But unfortunately, that is not the case.
Okay. And what about people using pumice stones and so forth on their calluses and files?
So I am okay with using a pumice stone. I don't recommend using the sharp blades, especially if you're diabetic or have any form of peripheral arterial disease or neuropathy. I definitely don't recommend using anything sharp on your foot because you can definitely damage the skin barrier and not know it. In the case of diabetics, your body has a harder time fighting off infections. So a break in the skin, bacteria enters that break, can become a significant problem for you as compared to somebody without diabetes. Same with somebody that has peripheral arterial disease. If there's not enough blood flow to heal the wound, it's not going to heal. And that small break in the skin can now become something very significant that can lead to an amputation.
Yeah. And when you're using a pumice stone or a file, you're only trying to remove the dry skin that's dried up, not functioning. The skin is thickened for a purpose. You want to keep that thicker skin, but all the dry, hard stuff, you can lightly remove that and then put on moisturizing cream and Vaseline or cocoa butter on top of that.
Yes, and if the skin is significantly dry, a debriding agent such as urea or salicylic acid can be used to help to break down some of the thick skin on the heel without causing significant damage. You just have to be mindful of the strength of medication that you're using. So I definitely would recommend seeing a podiatrist to get the right prescription to use, because at the end of the day, those are acids. And if you get it on the healthy skin, it can break that skin down.
And there are definitely times when you need to see a podiatrist when it comes to dry skin. And this is a classic example when the skin is dried and thickened and cracks occur in it. And the cracks go past the dry layers, past the thickened good layers, and it's going straight into the flesh, and it could bleed and so forth, okay?
Yes, and these can often be very painful. It's very similar to a paper cut where it just damages the first layer and the nerve layers are exposed. So these cracks in the heels can be very painful. And one of the biggest things that you can do to help to prevent this is moisturizing the skin, but also wearing the correct size shoe and avoiding open back shoes. So flip-flops, sandals, avoiding those, and that helps to decrease the amount of pressure that's placed on the heel, which will then decrease the callus formation, because as we discussed earlier, calluses are in response to friction.
Let's deal with this one. Chilblains, cold damage, heat damage, gout.
Yeah, so there's several skin conditions that can present like this. So definitely seeing a podiatrist to be fully evaluated, having a full history is definitely beneficial. especially if you're compromised in any way. So diabetic, peripheral vascular disease, forms of neuropathy, or any autoimmune diseases, anything like that would compromise your immune system. It's definitely important to be evaluated sooner rather than later.
Yes, and if this was cold damage, you will still want to get medical help. So if you're seeing skin damage like this, you need to get medical help. Okay, don't try to fix this up yourself. Okay, because the skin is thin, it can break and it can ulcerate, and then it's a nightmare trying to heal an ulcer in a shoe over a long period of time. Let's answer some of your questions. Where did we go? There's one about a scoliosis area. I have scoliosis and one leg is longer than the other. What can I do?
So it depends on how much of a difference there is, how long it's been present, because our bodies are very adaptable. They can compensate for various things. So it depends on the compensation that's already occurred in the body for this scoliosis and the limb length. That would determine the types of treatment that would be done. So there's different things that can be done: bracing, lifts in the shoe, lifts outside the shoe. Surgeries can be done to lengthen the shortened limb. It all depends on the overall patient.
Yeah, and also it depends on your age as well. This would be far better in a younger child than in an adult. That's right. This invasive treatment. My assumption in the question is that you're a mature person, you've had this limb length difference all your life, and as a result, it's developed scoliosis. In which case, I would see that there's very little that can be done just to minimize the onset of the scoliosis getting worse. And you would the difference between the two legs, that should be your heel raise that you're trying to do. You're trying to raise up the lower foot. Okay, or you can buy specialized shoes which are thicker, have a thicker sole than the other, but everything's going to cost. So how can you recover from plantar fasciitis?
So the biggest maintenance for plantar fasciitis is wearing the appropriate shoe gear and stretching. Even after your pain is gone, being sure to stretch to maintain the length in the hamstring and the calf muscles to prevent the tension on the Achilles and the plantar fascia. It's that tension on the plantar fascia, that pulling, that causes the pain and inflammation, well, the inflammation that results in the pain that you're experiencing. So wearing the appropriate shoe to provide enough shock absorption, decrease the amount of pressures and forces going back into the heel to decrease the inflammation, and also stretching exercises.
And you could also try some hot cold treatments to help reduce the inflammation. And if it persists, you can have steroid injections. I don't know if they still do those. When I was being trained with steroid injections into plantar fascia. Yes,
we can do steroid injections into the plantar fascia to decrease the amount of inflammation, but you definitely don't want that to be your course of treatment. A steroid injection is more so to alleviate the amount of pain that you're getting, so you can do the stretching activities that are prescribed, and also being able to carry out your daily activities while doing the stretching to decrease the amount of pain that you're getting. The steroid injection by itself, if that's the sole treatment, the plantar fasciitis will be back as soon as that steroid is no longer working.
Yeah, if you don't fix the problem. Tabitha says, I'm experiencing pain in the metatarsalgia area of the metatarsals, she should be saying, the metatarsals and of my feet. How would I solve this issue? For me, I found the question slightly vague. pain could be for right.
Right. And it would depend on what's causing the pain in that area. There are several structures in that area. It all depends on where exactly the pain is, how the pain presents. That would definitely require an examination to be able to answer that question. There's several things that can contribute to pain in that area. Being able to identify what it is that's causing the pain is how we're going to be able to alleviate the pain. In general, most commonly, the pain in that area is from wearing high heel shoes that put extra pressure on the ball of the foot, wearing inappropriate shoe gear, so sandals, flip-flops, causing strain on the toes, because your toes are what grips to keep the flip-flop on your foot, and that puts extra strain on that area as well.
Yeah, your toes are holding the shoe on rather than the laces.
Correct.
Okay. Pixel 6 Pro said, I stand on concrete all day. My legs and feet hurt all the time. Unable to stand. Can this be reversed and be able to stand without pain?
I don't know if it'll be able to be reversed. Concrete is very unforgiving. So wearing a supportive shoe, wearing an orthotic, wearing compression garments to help to decrease the swelling in the lower extremity from standing for such long periods of time, you're going to get swelling, and that's going to cause pain. Those are probably the biggest things that you can do to help to decrease that pain. And of course, stretching the calf muscles, stretching the hamstrings, stretching the quad muscles, just trying to improve your mobility, but also trying not to stand in that one position, maybe moving back and forth, allowing those different muscles to contract throughout the day instead of standing fixed in that position. Maybe if you can get one of those mats that they have for the construction, the concrete floors, to help to cushion some of those forces that you're getting from standing on the concrete. But concrete is very, very unforgiving.
Sure. Yeah, and this is where good quality shoes really help. If you spent a lot of money having some really great quality shoes with a cushioning sole and a cushioning insole and enough room in your toe box, then you will fare a lot better, because your workplace may not give you a cushioning mat to stand on, okay? So you need to invest in your shoe. Spend the money, bite the bullet, spend the money, and get good quality fitting shoes, and you'll be able to stand longer. The exercise, rocking backwards and forwards on your feet, going from moving your weight from your heel to the ball of your foot, back to your heel to ball of your foot, doing that will help, because the calves will contract in order to do that, and that will help to the flow of blood back to your heart. I broke my ankles 3 weeks ago. I'm in a cast. I went to the orthopedic, and he said it was still not mended. What can I do to further facilitate my healing? Are there any herbs I can take or other natural remedy, please?
So being compliant with your non-weight bearing status. So if you've been told not to walk on it, not walking on it, using your crutches or a knee walker or whatever assistive device that you have to decrease the pressures and allow those bones to remain in a fixed position. Calcium, vitamin D are also beneficial for accelerating bone healing, but it's going to take the time that it takes. Your body has to repair itself. And so depending on what exactly was broken, it can take anywhere from 6 to 8 weeks. It can be, depending on your age, it can be sooner, but on average, it takes about 6 weeks to heal a broken bone.
Okay. And the other thing is this, your healing rate depends on your natural health. Okay, this is something you should have had beforehand. You can't just switch it on when you need it. Okay, so if you were very healthy before, you will heal a lot quicker. But if you had poor health before, your healing rate is going to be slow, and you can't just accelerate it when you need it. You just can't turn it on like that. It has to be something that you want to have, and you maintain it on a regular basis. Okay, we spoke about harvesting the fat. How often should you get a pedicure? Let's talk about that when we talk about nail care. We'll talk about that when we talk about nail care. Let's move on to washing and drying your feet.
So washing your feet is very important. Being sure to clean between the toes is very important, but also more importantly is drying between the toes after showering. Between the toes naturally produces their own moisture. And so you want to remove any excess moisture because unfortunately the toes stick together, which is a dark environment. If there's moisture, added moisture in that area, that then becomes the perfect environment for viruses and bacteria and fungus especially to grow between the toes. So cleaning, washing, drying between the toes, very important. And then moisturizing your skin.
Yep. Yeah, and your feet shouldn't smell.
Right.
They shouldn't smell. If your feet smell, something is wrong. You shouldn't have funky feet. And you need to have fresh socks every day. If you're a sweaty type of person, you may need to change your socks twice a day. Okay. And if your footwear doesn't allow enough air to get through and your feet are hot and sweaty, and that's not evaporated away, that's going to be a problem as well. What about powder between the toes? Dr. Robinson, any comments on that?
You can, if you have especially sweaty feet, you can use powder to help to keep between the toes in your shoes dry, especially an antifungal powder. Because that added moisture creates the perfect environment for fungus to grow. So an antifungal powder can be used, cornstarch can be used just to keep between the toes dry.
Okay.
But not too dry. There's a healthy balance, because then if it gets too dry, then you have new issues.
Yeah, and when you're drying your feet, I know they're a long way away, but get down and examine your feet whenever you dry them. Just check them over, check between the toes, check the sole of your foot, if you can still get your foot up that high, check your heels, check your skin condition. So just give them a quick look over when you are drying your feet and you're creaming your feet. If between your toes, the skin is white, that means the moisture content of the skin is too high. You need to get some more air to your skin, and you need to have it dried. But you need to let that air dry out so the moisture level goes back down. What about nail care? Let's talk about pedicures now.
So taking care of the nails is very important. I usually recommend to follow the natural shape of the nail. Some people advise to cut them straight, but if your nails aren't straight, there's really no reason to cut them straight because that can cause other issues. So just following the natural shape of the nail, leaving a small amount of white visible at the tip of the nail. If you have very high skin fold, so the skin on the side of the toe is the skin fold, and for some people they're very high, and that predisposes to ingrown toenails. So allowing a little bit longer of a nail will help to decrease that nail from pinching the side of the skin, which then can cause pain and infections. And also using quality nail polish if you're going to be painting your nails, because some of the nail polishes have very dangerous chemicals in them that can dehydrate and damage the nail, but also get into your skin. So using a quality nail polish, I usually recommend Dr. Remedies. It's a vegan, all natural nail polish. It has antifungals and moisturizers in it. So that's usually what I recommend if you're going to be using a nail polish on your nail. And also if you go to the salon to get your nails done, bringing your own nail polish with you, so that way you're not reintroducing anything new that was on somebody else that's now put back into the bottle and then put onto your feet.
What about cuticles? I know some pedicures, they have to remove the cuticles and push them back and so forth.
So there is a layer of the cuticle that sheds over time. For some people, that shedding is delayed and you get a buildup of the cuticle. You can push them back a little, trim them a little, but usually I don't recommend it. The cuticle is there for a reason. It acts as a barrier to the nail root, which is where your blood vessels are. You can get infections if you get bacteria into that area. So the cuticle acts as a protective barrier to protect the nail root. So definitely not trimming it back all the way. But if it's lifting and white and hard, then you definitely want to trim that back. But you shouldn't be pushing them back to trim skin. That shouldn't be happening.
Yeah. Sometimes they attach to the nail and grow forward with the nail, and you can see it sort of stretch. That's the time when you can push it back and ease it off the nail and push it back. But it's there to protect your the nail bed. So definitely don't have it cut off. Okay. Let's answer this question. Somebody asked about how to eliminate toe fungus, toenail fungus. So let's talk about that. Toenail fungus.
So the biggest thing is making sure that you actually have fungus that's causing the changes to your nails. Bacteria can cause changes to the nails. Trauma can cause changes to the nails. So if you've dropped something on your toenail, or somebody has stepped on your toenail, that can cause trauma to the nail root, which then allows the nail to grow out thickened and discolored, which will look similar to what one would identify as a fungal nail. So being sure to identify that it is indeed fungus that's causing the changes that you're noticing to the nail. And if it is a fungus, then an antifungal regimen. So whether it be a topical antifungal treatment or an oral antifungal treatment to treat the fungus in the nail. But in preventing fungus from getting into the nail, if you don't have one, maintaining the cuticle, proper trimming of the nail, so not trimming the nail back too far, maintaining the moisture in the nail, so using those damaging nail polishes that dry the nail out. Not drinking enough water causes dehydration of the nail, which causes separation of the keratin plates, which allows fungus to get into the nail. So those are all things you can do to protect your nail if you don't have a fungus. And then if you do, antifungal treatments to treat the fungus in the nail, and also treating the environment. So the shoe that you're putting your foot into, treating the fungus that may be living there as well, so that if you do indeed get rid of the fungus from your toenail, you're not putting it back by putting your foot back into the shoe that then houses that fungus. And overall, in general, everybody should be cleaning their shoes, removing the inserts, washing them if you can, wash the shoe if you can, to eliminate fungus, because fungus is everywhere and it will inevitably get into the shoe.
Sure. So on this picture you see here, everybody, the fungus has gone down the nail and it's all the way past the nail fold, proximal nail fold, and in the nail bed. What we're seeing is the residue, what the fungus has already eaten, and it's only the active fungal areas is right at the nail fold. So back in the day, what I would do, personally as a podiatrist, I would remove as much of this nail as possible, because it's all dead, it's useless, and then put the treatment directly on the nail bed and around the nail fold. I don't recommend that you do that, but sometimes your nail is composed of 3 different layers, and different fungi eat different layers of your nail. And the most common one is the middle layer of your nail, and you will still have the top layer of your nail, which is a hard layer, okay, lifting up. So that can be a danger, because you can pull on some hosiery and it can get caught on the nail and you can pull the nail back. So it may be pertinent to trim that nail back, and then you can put on your topical treatment. Now you have to understand, when you put in on a topical treatment, okay, and I prefer topical than oral because I'm against taking anything allopathic. When you put it on a topical treatment, you have to realize it takes about 18 months for a full nail to grow. So you're in it for the long haul. Don't think you're going to put this on for 2 weeks and it's done, okay? You're going to be putting it on for months until it completely grows out and you cut off the last little bit, and then you put it on for a little bit later. And most topical treatments will slightly discolor the nail, okay? I hope that answers the questions about the nail fungus. Okay. Teresa asks, is it good to sleep in socks? Just a random question, just an easy one for you.
I mean, I don't think it's good or bad. If you like sleeping in socks, you sleep in socks. Make sure they're clean. Make sure your feet are clean. If you have sweaty feet, I don't recommend it because that adds extra heat, which causes increased sweating and moisture, which is the ideal environment for fungus. But removing all those things, if the sock makes you feel better and more comfortable, have a better night's sleep, because sleep is very important to our overall health. So if the sock aids in you having a better night's sleep, then wear your socks.
I think she should ask her husband, you know, if he likes with socks on. I just played. Okay. But your socks that you wear to bed, if you're going to wear socks to bed, need to be a pair of socks that you reserve for wearing to bed. Don't wear the socks you've worn all day to bed. That's nasty. Okay. So you take the socks you've worn all day, you put them in the laundry, you have your bed socks, okay? Having warm feet actually helps you sleep better. The story of Boaz and Ruth is the example of that. She made his feet cold and he woke up, okay? So having some warm feet is good.
And you also want to change the sock that you're sleeping with. You don't want to wear the same one. If you do have socks, like you said, to wear at night, you don't want to be wearing the same one every night, because that's the same thing as wearing the same sock multiple times throughout the day. It's the same foot, the same environment. So you definitely want to change the socks if you are sleeping in them, changing them every night, putting a clean pair on to go to bed every night, and then cleaning your feet in the morning and putting on a clean pair of socks in the morning if you do wear socks throughout the day.
Good, good, good. What do you do if you have bunions, and why do you get them? So let's start with, why do you get bunions? How do bunions occur? So you want to tell us what a bunion is, because not everybody has bunions, and then tell us how they occur and the treatment, the cheap treatment and the expensive treatment.
So bunions are mostly hereditary. The foot type, there are certain foot types that are more predisposed to developing bunions. And if you inherit that foot type, then you're more predisposed to developing bunions. There are certain shoe gear that can aggravate or accelerate the progression of your bunion, but it will not cause a bunion. If you weren't supposed to have a bunion, your foot type does not support having a bunion, then you won't. But there are certain shoe types that will aggravate the bunion and make it worse, more painful. But bunions are hereditary. So the bunion is at the bottom of the big toe, on the side of the foot. You'll develop a bump on that side, which is actually the head of the metatarsal that's pointing out in that area. And that just happens because of the foot type that you have. What can you do for bunions? Wearing the appropriate shoe gear. So wearing a shoe that has enough width across the widest portion of the foot, which is right across the metatarsals, so that there's enough room, there's no compression on that area. If most people that develop bunions also have some form of collapse of the arch, so supporting the arch, an orthotic will help to decrease the collapse of the arch, the strain on the arch, which will then decrease the progression of your bunion. And then if it is still painful and still causing you issues, then there are surgical options to correcting your bunion, and that will depend on the size of your bunion, the goals that you're trying to achieve with your surgery, your overall health. All determines what surgical option would be available to fix your bunion.
Wow, okay. So I learned something new. I didn't know it was hereditary. We learned today that it was all footwear, you know. And
now bunions are hereditary.
When people had a very narrow toe box, especially the ladies, but ladies, mostly ladies have bunions. The narrow toe box, the big toe is forced over. Instead of lying straight, it's forced over because the toe box is narrow. And because it's trying to work at an angle, that's why. But hey.
So it's actually a misnomer that women have more bunions. Women are more likely to complain of bunions because our shoe type is less forgiving and less able to facilitate the bunion. Whereas for men, if they have a bunion, their shoe is flat. There's usually no incline in the shoe. There's usually a wider toe box to accommodate that extra protrusion that would happen on the side. And also men tend not to be as concerned with cosmesis as women are. So that's usually why there's more women that report having a bunion or wanting to have bunion surgery to correct the bunion. It's because of the shoe gear that most women traditionally wear is not created to accommodate a bunion. But it's usually even across the board, men and women having bunions.
Okay, so let's move on to the next section, which is some other nail issue. We've got ingrown nail, ingrown toenail. We've got a this thickened onychogryphosis, and we got a damaged nail bed and the hematoma underneath it, or any other issues.
There are also some systemic issues that can present in the nail. So liver failure can present in the nails, kidney failure can present in the nails. You can also get cancer of the skin. Well, really it's the skin underneath the nail. So melanomas can develop around the nail, under the nail. Those are all things that can present and be identified in the nails as well.
Okay, so the blood underneath the nails usually caused by trauma.
Yeah, so dropping something on your toe, somebody stepping on your toe, wearing a shoe that's too small where the toe is hitting the front of the shoe, traumatizes the nail root and causes bleeding underneath the nail. So once the blood vessel is broken underneath the nail and that blood stains the back of the nail, it stays there. And so it won't go away until the nail actually grows out and you trim those pieces off when you cut your nails, similar to dyeing your hair.
Sure, yeah, it has to grow out. It has to grow out. If you damage it and the pain continues and your toe starts to swell, that means you have ongoing bleeding underneath your nail and you need to go to ER to get
right away.
Pressure
Yes.
released. Okay. And the thickened onychogryphosis, what we're going to do about that one? This is just how is this caused?
So it can be caused by fungus. It can be caused by trauma as well. Most commonly when the nail is fully intact and the direction of the nail changes, that's usually an indication that there's been some form of trauma to the nail root to alter the direction of growth of the nail plate itself. Sure,
yeah. Yeah, because the nail bed, which is producing the nail, is damaged, it inflames, and instead of going back down to its normal size, remains thickened, and a thickened nail bed produces a thickened nail, and it grows grotesque like that. What can be done about that? Can it be remedied?
So unfortunately, once the nail root is damaged, it usually remains that way. We can remove that nail. We can have it regrow to see if it will regrow in a more acceptable way. But usually when it's this bad, removing it permanently and not having that nail grow back is usually a better treatment option.
Yeah, yeah. And what about this ingrown toenail?
So ingrown toenails are caused by inflammation of the skin surrounding the nail. It can be caused by the nail, the shape of the nail changing and pressing into the skin, but it can also be caused from trauma. So if you wear a shoe that's too tight or someone steps on your toe and it causes inflammation of the skin around the nail, that then can lead to an ingrown toenail. You can also develop an underlying infection in that area because unfortunately toenails are dirty. And so there's lots of bacteria that lives on the toenail and on the skin itself. And with that breaking the skin, that can then get into the nail, into the skin, causing an infection. It's also very important to get ingrown toenails treated as soon as possible, especially if they do become infected, because with the toes, it's the skin some tendons and bone. And unfortunately, if that infection gets deep enough that it gets to the bone, it can result in an amputation simply from having a untreated infected ingrown toenail.
Sure. The toenail with which it's hair is infected. You can see the red inflammation and some attempts to heal granulation tissue up in here. Yeah, so it needs to be treated. And if it's an ongoing, if you keep on getting ingrown toenails, is there a cure for ongoing, reoccurring?
Yes, there is. So we can remove the portion of nail that's causing the issue all the way back to the nail roots and not have that small portion grow back in the future. We can remove the entire nail completely and not have that grow back. We can also use a brace to help to change the shape of the nail if it is indeed the shape of the nail where the nail curves down onto the side and curves down into the skin. If that's what the issue is, then we can retrain the nail, essentially, like braces for your teeth, braces for the nail plates.
Yeah. Okay, let's move on. So we've spoken about nail polish. You giving your recommendation. Could you type in your recommendation into the chat box?
Sure.
Brand of nail polish, which was vegan. Not that we eat the nail polish, but okay. Then let's go on to sports injuries. So I remember having a sports injury. I was playing soccer and with teenagers. As an old man, I was the teams director, and I jumped up and my Achilles tendon snapped, pop, and I was in a thigh-length cast for several weeks trying to heal my Achilles tendon conservatively, and it did. But sports injuries can be very painful and debilitating. What are some of the common sports injuries that people encounter?
So most commonly plantar fasciitis, Achilles tendonitis, strains and sprains, ankle sprains. Those are your most common injuries that are incurred. In children, you'll get inflammation of the growth plates. So the back of the heel is called Sever's disease. So you'll get that in kids. And we usually used to be a little bit older, but we're seeing it in younger kids because of the increased specialization in sports. So usually kids would play several different sports, which would allow for different muscles. There's different muscle groups that are used predominantly in different sports. So playing several sports would allow for strengthening of all those muscles, whereas specializing in a specific sport and a specific position in that sport causes overuse of certain muscles. And so you're getting inflammation of those growth plates. So that's common sports injury that we see in kids. Kids are more likely to get strains and sprains, inflammation of the growth plate rather than breaking a bone because your bones are very soft and pliable.
Okay, you want to explain a growth plate because you just threw out a technical term not everybody knows where a growth plate.
Yes, so the in order for the bones originally are cartilaginous, made of cartilage when you're developing, and when you're born, there are certain areas of the bone that are still soft, that are cartilaginous, and those are the areas where you get the length of the bone from. So the bigger your growth plate is, the longer your growth plate stays open, the longer that bone would get. So you would essentially be taller, and you can get damage to those areas because they're soft. You can get inflammation in those areas for kids or who would have open growth plates, so that you get inflammation in the area where the bone grows from.
Okay, sprained ankles, very common treatment.
Yes, ankle sprains are very common. The most common treatment that works is the RICE method. So rest, ice, compression, and elevation is the treatment protocol for an ankle sprain. The biggest thing is your ankle sprain should be getting better. In a few weeks, 2 weeks or so, you should start to feel some improvement. It really should not be severely painful to stand on. It will cause pain, but it shouldn't be excruciatingly painful to stand on. Those are more indicators that you've actually broken something, and that needs to be evaluated right away. If you're getting significant bruising around the ankle, the heel, the leg, that needs to be evaluated as well, to make sure that there isn't something else going on. But sprains take a very long time to heal. They're very, very common. You want to, like I said, rest the area, ice it, compression, so a compression sleeve to help to decrease the swelling in the area, and elevation as well to help to decrease the swelling in that area, and trying to limit the activity as much as possible.
Yeah, and it's very hard with feet to rest them, because you got to get up to use the restroom, you got to get up to have a shower, you know, so you're just trying to limit the movement as much as possible, and to have the rest. But it's unlike an arm, which you can put in a sling and you never use it for 2 weeks. You can't really do that with a foot. It's gonna
Yes, and it is, and that's true. And it's also very important for your physical therapy after an ankle sprain, because you've essentially lengthened those ligaments that support the ankle, stretching them out, which then predisposes you to another ankle sprain. And so if you don't do the appropriate physical therapy after an initial ankle sprain and get the appropriate treatment, then you're more likely to suffer another ankle sprain, unfortunately.
Yeah. Yeah. Let's talk about bursitis.
So there's several bursas in the body. They're sacks of fluid.
Oh, yeah.
A sac of fluid that helps to protect an area, cushion an area. And if there's increased strain or pressure or injury to that area, you can get inflammation of the bursa. You can also develop bursas as a protection, especially about the Achilles tendon. You can develop bursas in that area that can become severely inflamed because of irritation from shoe gear, rubbing on the back of the heel. Your body is always trying to protect itself. And so you'll get enlargement of these bursas in trying to decrease the amount of pressure and forces that are being placed on these tissue by your shoe gear or activity or anything like that.
Okay.
But bursitis is an inflammation of the bursa. So you have naturally occurring bursas, and if they become inflamed, you now have bursitis.
So you can treat them by rest and ice, hot and cold treatments. You can also have them injected with steroids, which will also take that inflammation as well. And you can just have them strapped down. Usually we tape them down with some really restrictive taping to help them. What about Achilles tendon? How do you heal an Achilles tendon?
So it depends on what's wrong with the Achilles tendon. If we're simply talking about Achilles tendonitis, which is an inflammation within the Achilles tendon, then it's similar: rest, ice, compression, elevation initially after whatever initial injury that caused damage to that area. But after that is stretching exercises to maintain the length of the hamstring and the calf muscles to decrease the pull on the Achilles tendon and on the heel, which will then cause additional inflammation and pain. Wearing the appropriate shoe gear, wearing the appropriate fitting shoe gear, stretching before your activities. Achilles tendonitis is a common injury that you would get when you go out you wake up tomorrow and you decide you're going to clean the entire yard that you haven't done in a year. A common injury that you would experience is an overuse injury, and Achilles tendonitis is predominantly one of the injuries that most would suffer from an activity like that, or deciding that you're all of a sudden going to go back to playing basketball. And then you'll have significant pain in the heel the next morning when you wake up. So those are the initial treatments. And then wearing the appropriate shoes, wearing an orthotic can help. A heel lift will help as well.
And if it's ruptured, fix it. But first of all, when it's ruptured, you're going to ER to get it sorted out. Okay, there's nothing you can do at home. They'll do it either conservatively, which they did with me. They put the two tendons in close proximity and they naturally will knit together without surgery. Or they will go in and they will splice the tendons and they'll stitch it back together. Okay.
Yes, it depends on the severity of the tear, the location of the tear, how much of the tendon is actually missing or damaged. Those all go into, and your overall health. Those all go into account to determine the likelihood of your tendon repairing itself on its own. The issues with tendon is they don't have their own blood supply. They have to rely on the tissues around them to provide blood supply to them. And so if the tissues around the tendon are damaged significantly with the injury that you incurred that caused the rupture in your tendon, it's now less likely that the tendon will repair itself and repair itself well. It can scar down, which is not a healthy repair of the tendon. Scar tissue does not have any mobility to it, and so that would significantly alter your mobility in the calf muscles, the way you walk, things like that.
Okay, let's talk about the diabetic foot. This is very serious. Diabetic foot.
So diabetes is unfortunately, a very common condition in our society today. Approximately 1 in 10 people will develop diabetes. 1 in 3 will be diabetic. There's over 200 amputations that are done every day because of diabetes. And there are 2 different kinds of diabetes. Typically, they're called type 1 and type 2. We really don't call them that anymore. But your type 1 diabetes is usually a autoimmune disease, which presents during early childhood where you're not producing any insulin. And this would require medication to treat this type of diabetes. But your type 2 diabetes is more of a metabolic disease, and lifestyle changes, exercise, diet, all play into this form of diabetes. So while I do encourage my patients to do this healthy alternatives, I also encourage them to take their medications until your numbers are down enough that you can come off of the medication and manage your diabetes with natural remedies. Because diabetes is one of the things that affects every aspect of the body. And oftentimes the damage that's caused by diabetes is irreversible. So having a high blood sugar for long periods of time causes damage to your heart, to your eyes, your kidneys, your skin, your nerves, everything. And so not treating your diabetes appropriately can cause significant issues later down the road. So if you are diabetic, and you have your blood sugars are not severely elevated, then yes, trying a natural alternative to try to lower your blood sugars is very beneficial. But if your blood sugars are very, very high, your A1C is very high, which is the 3-month marker for what your blood sugars have been doing, then medication in addition to lifestyle changes are very important. And then when those lifestyle changes catch up to lower your blood sugars naturally, then decreasing the medication that you're taking to eventually get off of the medication if you're able to get down to an acceptable number. Yes, that's would be my recommendation, because the damage to your heart, the damage to your eyes, the damage to your kidneys is irreversible. Once it happens, it happens. There's nothing that can be done to reverse it. So being sure to appropriately and very tightly managing your blood sugars is very, very important.
You know, the thing about the diabetic foot is that it's like a barometer of your general health. You can see a lot of how your diabetes is being managed through your skin quality, your nail quality, your sensitivity in your foot, and the temperature of your foot, and the swelling and so forth. Your foot health is an indicator of how you're managing your diabetes in general. So you need to be very, very careful about your feet. Make sure that there's nothing in your shoe, because it's very easy to have a small pebble in your shoe, walk around it all day and end up with an ulcer. Take very good care of your skin, massage your feet, get your feet up, look after your nails. Yeah, and do everything that Dr. Robinson is saying. Okay, any other questions? because we're about finished here.
Okay, we can open it up for them to actually raise their hands so that they can actually ask the question themselves.
Okay,
So
so there's one question that said, what is the best layman way of treating deep, sharp, shooting pain from hip to ankle after falling on buttock?
So this sounds a lot like nerve pain, sciatica specifically. So the sciatic nerve comes down, crosses through the pelvis, around the hip, and comes down the leg, branches into several different nerves that provide sensory to different parts of the body. Now, if you fall on your bottom and causing inflammation and compression of that nerve, then yes, you're going to get pain and sharp shooting pain down the hips along the entire path of that nerve. So doing things to naturally decrease inflammation in the body, so avoiding foods that are inflammatory, taking an anti-inflammatory, icing that area. And if that is not working to alleviate your pain, in usually about 2 weeks, 2 to 3 weeks is usually the max that I tell anybody to try anything. If that's not helping, then you definitely need to have it evaluated by a doctor, because you can get damage to the nerve that's irreversible depending on how hard you fell. You can have fractures of the sacral bones that can cause issues as well. So definitely, if it is not improving, seeing somebody to be evaluated to make sure that there's not anything else that's going on, because nerves, unfortunately, do not regenerate. So damage to them can be, if not treated right away, can persist indefinitely.
Okay, so Dr. Robinson, let's just break it down. When you think about the backbone starting from your neck, where is the sciatic nerve coming out, the pair of sciatic nerves?
So the sciatic nerve is coming out of the lower back, so above the hip and coming down, courses through the hip, which is why when you would fall on it, it would become compressed by the gluteal muscles and also the hip bone, depending on how you fell. And that causes inflammation in that area that then causes compression of that nerve. And this is only specifically dealing with this specific injury. There are several other things that can cause sciatic pain, but this specific injury that was presented.
Okay.
Okay, we have Brother Joseph. Can you unmute, please? Okay, he may not be able to unmute. Are you there?
Yes, can you hear me?
We can. Mm-hmm.
Okay, great. Several years ago, I was diagnosed with chronic regional pain syndrome in my left foot stemming from the big toe. Do you know of any way to treat chronic regional pain syndrome? I don't really know how it originated. There seems to be some thought that it may have been a sports injury, but I can't say for sure. But from the big toe radiating across the toes and up into the ankle area. And I've had a few surgeries as well, which didn't help.
Hey,
Hello?
Doctor, this one's for you because I've never heard of chronic regional pain syndrome.
Dr. Norshe, are you there? Are you able to unmute?
Now, I didn't hear the question. I don't know what happened with my audio, but it completely went out. So I'm not sure what the question was, unfortunately.
Well, essentially, I'm asking about chronic regional pain syndrome. If you've ever come across that, and if so, how to treat it in the foot area, especially radiating across the toes from the big toe towards the smaller toe. Not constantly, but it's enough that it gets your attention and affects the way you walk and
Mhm. What was the original injury that led to your CRPS?
I'm not sure, and the doctor's not sure. There's speculation that it may have been a sports injury, but all I know, back in 2010, one day while I was laying down, just the weight of the sheet on my foot was sufficient to cause discomfort and a lot of pain. And since that, I've had problems wearing various shoes, sneakers, and even laying down and the weight of the sheet on the foot and various thicknesses of sock. So it's really just the sensitivity that is being caused by various media in and around the foot.
So unfortunately, CRPS is not well understood. It's usually treated by a podiatrist and a neurologist because there is a significant neurological component to CRPS, but it usually is a time thing. So unfortunately, the treatments that are provided will help to alleviate some of the symptoms, but CRPS is usually self-limiting, but that time is usually 3 to 5 years. It's a very long time that you would be dealing with those symptoms, unfortunately. There's usually an initial injury that precipitates the CRPS, but then, yes, it would cause significant pain because of the disruption in the neurological signals that are being transmitted, which is why the stimuli that should not be painful, such as the sheet on your foot, then becomes painful. So it would need to be treated by a neurologist and a podiatrist together to manage your symptoms, but you would not be pain-free unless your CRPS is self-limiting.
Self-limiting in what way?
So for the most part, most patients that develop CRPS usually suffer with their symptoms for about 3 to 5 years. And then after that, the symptoms start decreasing, if not going away all on its own. But that does not happen for everyone.
Unfortunately, it doesn't happen for me. I've had neurologists and pain management doctors and podiatrists all working together. And unfortunately, it hasn't helped me very much. And this has been since 2010.
Yes. That's the unfortunate side to CRPS. We just don't really have a treatment for it. There's things that can be done to alleviate some of the pain that's experienced, but unfortunately, there is no treatment.
Well, unfortunately, I've run into a few of those dead-end responses, which really have left me kind of with a lot of angst, a lot of pain and frustration, which, no disrespect to you, I'm just letting you know the...
No, I
haven't got the key.
Yeah, I understand. CRPS is a very frustrating disease for us to treat as well, because you don't have a cure for it, and it's very debilitating for your patient. So.
Okay, thank you.
All right, thank you, Brother Donald. I hope you get some relief somehow.
Yes.
Have you tried hot and cold?
Yes, everything. I mean,
Everything.
even like nerve stimulators and, trying to put like a nerve block, which really hasn't helped very much.
Okay.
Wow.
Okay. Let's take Sister Tabitha's question. Sister Tabitha.
Okay, I think she's not able to unmute.
Okay. So, Dr. Robinson, what's your recommendation for moisturizer? Your recommended brand?
So that depends on the patient, their overall health, the severity of the dry skin. Those all play a role. There's different moisturizers that provide different benefits. Usually I recommend Eucerin for my patients, and there's different products in the Eucerin line depending on the severity or the symptoms that you're dealing with. So for severely dry skin, the intensive repair has urea in it, which helps to break down some of the thick, dry skin to help better moisturize the skin. But overall, Eucerin is usually what I recommend. If it's thin, light, very watery, it's not going to really do anything for your legs and feet. That may work as a face cream, as the skin on your face is very different, but it usually does nothing for the feet, especially if you're experiencing dry skin. If you're experiencing dry skin, there's usually something that's wrong, and usually need a different type of moisturizer.
Thank you. Sister Linda, what's your question? Linda 43211.
Hi, good evening. I was trying to unmute and it was not working. Yes, I just want to know what causes lines in your nails and your feet, like dark lines. Is it a lack of some nutrient or something?
Okay, which way are the lines running?
They're running straight,
Okay.
straight from the tip to the, what should I say? And it's only like on certain toe, like one toe I have like that. And then the nails get a little rough and they seems to want to turn dark. So I might be lacking some nutrient or something. I don't know.
The lines are running the length of the nail, like
Yes,
the direction of your toe.
yes, please.
Okay, so usually for people of color, when they're develop pigmentation in the nail, it's because melanin, the same thing that gives your skin its color, gets deposited into the nail root and grows out with the nail. There's really nothing that you can do for this pigmentation. It's usually hereditary. So if usually there's someone else in your family that has this pigmentation of the nails, it's usually present in the hands and feet. Usually starts with the big toe and the pinky toe is usually where you see it first, and then it will move across the remaining fingers and toes, unfortunately. Usually starts with streaks, as you described.
Yeah, but there's
So,
no
Dr. Norshe, I would like to ask, because I know that you said in people of color, but also could it be also a fungal type of thing that's happening as well?
Yes, there are fungus that can present with hyperpigmentation in the nail, but for our Caucasians, pigmentation in the nail usually is more likely to be cancerous in nature. So if you're Caucasian and have pigmentation to the nail, that definitely requires further evaluation and a biopsy to be sure. That can also be for people of color, which is why it needs to be examined to see the presentation of this pigmentation. But if you're getting pigmentation across all your nails, or you have the little streaks, usually you hold your hand to the light and turn your hand side to side, you'll be able to see those lines in the nails. That's usually as a result of melanin being deposited in the nail, and it's most commonly seen in people of color.
And there's no harm in it. It may look unsightly, but there's no harm in it. And the nail.
But how would, but Dr. Norshe and Pastor Hines, how would you know if it's because she mentioned earlier about the liver element that happens with discoloration of your nails? How would you know if it's that, or if it's fungal, or if it's just lines?
So you would need to be seen by a podiatrist to have it evaluated, because all of these conditions present differently in the nail. They look differently in the nail, and a full evaluation and workup is often warranted in this case, because there's things that to the untrained eye can look the same, but they're not the same.
Okay. So I want to thank everybody. I just want to remind you that my cousin, Dr. Robinson, has a practice in Jacksonville, and that's her contact detail, her number. So if you're in the area, you need professional Adventist help, please check her out. Or if you know somebody else who needs professional help, you can recommend somebody else. Well, if you're going through community, you're doing the foot washing, and you see somebody needs some help, send them to Dr. Robinson.
And you are, I heard from a bird that you're a pastor's daughter as well. So, I mean, you've come from a long line of knowledge, and you shared a lot with us today. Did you guys talk about neuropathy at all?
No, we did not specifically talk about neuropathy.
Because that's a big thing, especially right now, even in the face of COVID. Are you getting more people to talk about this?
So neuropathy is damage to the nerves that causes issues with the signal transmission. And there are several things that can cause damage to the nerves. The most common is diabetes. So the glucose in the bloodstream damages the sheath that protects the nerves, which then affects the transmission of those signals, presenting with neuropathy. It can present with loss of sensation, inappropriate sensations. So things that should be painful aren't, and things that should not be painful then become painful. You can also develop neuropathy from certain systemic diseases. You can also develop neuropathy from arthritis. Stenosis in the lower back can cause compression of the nerves as they exit the spinal canal, and that can result in neuropathy. So there's several things that can cause neuropathy. Identifying the cause of the neuropathy is usually more important than the neuropathy itself.
Okay, because I just wanted us to address that slightly, only because I know that, you know, with the rise of diabetes going on right now, and there is a rise in it. We're not sure if it's the use of the vaccine or just what's happening, but there is a rise. And what about vascular disease in the legs? How are people treating that now in the
So it depends on the presentation of your vascular disease. You can have arterial disease, you can have venous disease, you can have lymphatic disease. It depends on what is causing the vascular disease. That will determine the treatment of the disease and how severe or far progressed it is. So for people that are on their legs and feet for extended periods of time, wearing compression stockings to help to alleviate some of the pressure on the veins from gravity, decrease the swelling in the legs, decrease pain in the legs. I am of the personal belief that everybody should be wearing compression stockings to help to support the veins, because gravity plays a significant role in damaging our veins. We're mostly either sitting, which places our feet in a dependent position, or standing, which is even more severely placing us in a dependent position, which causes significant swelling. And if there is damage to the veins, this can happen because of inflammatory diseases. So diabetes, high blood pressure, high cholesterol causes damage to the veins, hereditary, and also occupational. So what you do for work.
Thank you. So you said everyone should wear socks.
Yeah,
basically.
I wear compression stockings every day. I mean, I recommend everybody wear compression stockings. That your feet will feel better at the end of the day. They won't be tired and achy at the end of the day, because unfortunately we can't all get up and walk every 10 minutes or so to exercise our legs and cause compression of the calf muscles. You can do little movements of the calf muscles throughout the day to cause help with sending blood back to the heart, but unfortunately that's not realistic for everyone. So wearing compression stockings, especially if you have a genetic predisposition to venous disease.
Veronica,
Okay.
you had a question, Veronica? And this is the last question. Veronica, can you hear us? You okay to unmute?
I'm unmuted now. Thank you. Thank you for taking my question. I had a question for my mom. I'm so glad, Dr. Robinson, that you said everyone should wear compression socks, because I've been saying that to several people, not just if you're, on your feet all day, but you see them more and more in stores, which makes me think, okay, this is not just for people with, varicose veins or whatever. But my question is, my mom has very bad varicose veins, and she has the compression hosiery, and she also has, I actually don't know the scientific name for it. It's a medical device though. I call it a boot. The boot, it's like a thing that goes all the way up her leg. It snaps on, and it,
the pneumatic compression pumps.
I don't know the proper name for it, but
goes on both legs.
Yes, ma'am. Yeah, she calls it a boot. So we all started just calling it a boot. Anyway, so she has those, but I noticed my mom around her, and she's not diabetic, although she is paranoid that she's going to become diabetic like her mother was, but she's not. She tests and everything. She's not. But in her brain at 88, she wants to keep pricking that finger. Anyway, but she has like on the Caucasian person, it doesn't, my mother is a little bit lighter than Brother Hines here, but so her leg from the lower part of the calf to the ankle, I'm noticing it darkening, and I'm concerned about that. And I wanted to know, is there anything I can help her? Is there anything I can do to help that? Or, over time my mother has really bad varicose veins that they literally stick out. You know what I mean? They literally stick out.
So the pigmentation that she's getting around the ankle is as a result of those varicose veins. It's because of the damage to her veins. The blood is staying pooled in the legs for longer periods of time. The iron that's naturally in the blood seeps out of the blood, and it stains the skin. In African Americans, it's a darkish purplish color that you would see.
Right.
In white, in Caucasians, you would see a more of a reddish purplish discoloration of the leg, but that's what's causing it. She's already doing pretty much everything she can be doing conservatively to treat this. So the compression garments, the compression pumps, walking, exercise, drinking enough water, managing any systemic conditions that she has, managing inflammation in the body, all of those things are what naturally can be done to help to decrease the progression of it. It is irreversible. The skin is stained. By the iron. Iron damages the skin, unfortunately. So those areas need to be properly moisturized, because that area is more prone to ulcerations as well.
Okay, so there's nothing I could do to decrease the darkness around her ankles?
No, there's nothing that you can do to decrease the darkness. It's more
or
so
rather not prevent it from getting worse, rather. I know
Right.
we may not be able to go backwards, but I'm trying not to, seeing if there's anything I can do to not let it get worse.
Right. So it seems as though she's doing everything that she can to help to decrease the progression of that. And the only other thing, which isn't recommended at her age, would be to have a procedure on those veins,
Oh,
the
no.
deeper veins, not the superficial varicose veins that you see. Those are cosmetic. It's usually the deeper veins that are the issue. And there's procedures that can be done on that, but at her age, you're already doing everything.
Okay. I just was hoping that there was perhaps some herb that I could put on there to increase the circulation around her ankles. But if that's not the case, then it is what it is. I noticed you put something in the chat, Brother Hines. I might have missed what you were pushing, but thank you. I will mute. Thank you, Raina, for unmuting me.
Okay. And just to remind you, you shouldn't really sit cross-legged with your knee all the way over. That causes a lot of pressure and helps to aggravate and stop varicose veins. But getting exercise, keeping the calf muscles pumping, the blood back is great. Don't force it to pull in your lower leg. Okay, Sister Robinson, we're ready to pray to close.